This topic is Kawasaki disease. So let's first discuss what exactly is Kawasaki disease. Kawasaki disease causes systemic inflammation within the body. Kawasaki disease is known most specifically for the involvement of the inflammation within the heart, so within the coronary arteries. The inflammation of these vessels is also known as vasculitis. Clients who are at most risk for Kawasaki disease are under the age of 5 and of Asian ancestry, but clients at any age group can acquire Kawasaki disease. Kawasaki disease is also known as mucocutaneous lymph node syndrome, so everything you need to know about it is in the name. You'll see clinical features within the mucous membranes. You'll also see clinical features within the cutaneous portion of the body, so the skin. And you'll also see involvement with the lymph nodes as well. And we'll talk about that in more detail in the next slide. Common complications of Kawasaki disease are also coronary artery aneurysm and myocardial infarction. So we can have a clot that forms in these cardiac vessels that causes a myocardial infarction, and this clot can also rupture, which causes an aneurysm. So let's dive a little bit deeper into the clinical features that we'll see with Kawasaki disease. As we discussed, this is a mucocutaneous lymph node syndrome. So the mucous membranes that you will see affected are the eyes. You'll see redness within the eyes without any drainage. You'll also see redness in the mouth, chapped lips, and the classic strawberry tongue presentation. If you see that, immediately think of Kawasaki disease. You can also see the cutaneous portion of the body involved. So you may see a generalized maculopapular rash. Macular just means there are flatter lesions on the skin, and papular are more like pimples or raised bumps on the skin. So you'll see a combination of this presentation in the rash. We also said that you would see the lymph nodes involved. So you'll see that the lymph nodes underneath the jawline are swollen and palpable. You'll also notice there's swelling to the hands and the feet. As this disease progresses and actually gets a little bit better, we'll notice that there's desquamation or peeling of the fingers and the toes. Kawasaki disease goes through several phases. So in the beginning, in the acute phase, we'll see the most progression of inflammation. We'll also see that there's an onset of fever. Typically, these clients have had fever for at least 5 days or more. We'll see these patients are more irritable, fussy, and cranky. And as this disease progresses and starts to resolve, we should start to see the peeling of the fingers and the toes. And that's also when we'll see the fever dissipate and go away. And then in the convalescent phase of Kawasaki disease, we should see all of these symptoms slowly disappear and eventually resolve. Here in this slide, we can see a better presentation of the classic strawberry tongue with Kawasaki disease. We also see these mucous membranes that are affected, the chapped lips, and the redness of the oropharynx. Nursing interventions we should expect to implement for clients with Kawasaki disease are IVIG and high-dose aspirin. Let's first discuss IVIG. Immunoglobulin G is an antibody that helps decrease inflammation within the body. So once we administer this, we should see all of the swelling and inflammation within the body and the coronary arteries decrease. Since we're having less inflammation after giving this medicine, we should see the fevers go away. So if clients ever experience fever after treatment again, they should immediately report it to their healthcare provider. High-dose aspirin is also important to administer to clients with Kawasaki disease. Let's remember that aspirin is usually a medication we do not administer to children, as it can lead to Ray's syndrome, which can be very dangerous. Kawasaki disease is the one exception to this rule because the benefits outweigh the risks for these clients. High-dose aspirin can help decrease any risk for any clot formation or thrombosis, which is most dangerous within those cardiac vessels. Since these clients are experiencing generalized inflammation, specifically in the coronary arteries, the lumen becomes narrow and blood has a harder time passing through, and they're therefore at higher risk of having a clot. They're also at higher risk of having these clots burst and cause an aneurysm. So aspirin is a very important intervention to implement for these clients. We also want to make sure we're educating our clients and their families that they receive the inactivated influenza vaccine. These clients are